सो हेलो हाय, अभी हम लोग लेग के प्रोजेक्शंस को देखने वाले हैं. सो बेसिकली वी डू लेग के टू प्रोजेक्शंस, एपी प्रोजेक्शन एंड लेटरल प्रोजेक्शन. एंड एनाटॉमिक स्ट्रक्चर्स जो लेग में शो होती हैं वो टिबिया एंड फिबुला होती हैं एंड नी जॉइंट एंड एंकल जॉइंट्स होते हैं. एंड लेग एपी हम लोग जो करते हैं उसकी पोजीशन क्या होती है. सो when we do leg AP, patient lies supine with limb extended and ankle is dorsiflexed and limb rotated medially, and the film must include both ankle and knee joints. And centering कहाँ होगी? Perpendicular to both axes of tibia and imaginary line joining malleoli. So centering should be perpendicular to the both axes of tibia and imaginary line which is joining to the malleoli. And image criteria should include entire leg including the knee and ankle joints should be seen. So here is our leg where knee and ankle joints should be included. Knee AP, leg AP view, and let's see leg lateral. So positioning of leg lateral should patient turns on the side being examined. Ankle is supported in dorsiflexion and the limb rotated until the medial and lateral malleoli superimpose vertically. लिम्ब को रोटेट करना है until medial and lateral malleoli superimposed हो जाए vertically, and middle of film at right angles of the tibia and parallel to an imaginary line joining malleoli. सो जो मिडिल ऑफ फिल्म है वो राइट एंगल्स होनी चाहिए टिबिया के एंड पैरेलल होने चाहिए टू एन इमेजिनरी लाइन जो कि ज्वाइन करती है मेल्यूलाई को. एंड दिस इज द रेडियोग्राफ ऑफ लेग लेटरल व्यू. एंड लेट्स सी इमेज क्राइटेरिया. Entire leg including both knee and ankle joints should be seen in lateral projection. So knee joint and basic view we do for the knee are AP and lateral projections. And AP knee positioning is patient lies supine and seated with support and the limb under examination extended, and rotate the limb to the central patella between femoral condyle. and जो लिम्ब को रोटेट करना जिसमें पटेला सेंट्रल होना चाहिए एंड बिटवीन फिमोरल कोंडाइल्स में होना चाहिए. एंड सेंटिंग शुड बी 1 सेंटीमीटर डिस्टल टू एपेक्स ऑफ द पटेला. 1 सेंटीमीटर डिस्टल होना चाहिए फ्रॉम द एपेक्स ऑफ द पटेला एंड डायरेक्ट सेंट्रल उस पर होनी चाहिए. एंड एनाटॉमिक स्ट्रक्चर्स शुड बी इंक्लूडेड नी जॉइंट, डिस्टल फीमर, proximal tibia and femur. So here this is a radiograph of bilateral knee AP view. And let's see positioning of lateral knee. And patient lies on the side under examination with knee flexed approximately 30 degrees, and the ankle on the side under examination is raised and on the small sandbag to bring axis of tibia parallel to the film. And anterior borders of the femoral condyles are palpated distal and posterior to patella, and limb rotated top superimposed the vertically. सो द जो एंटीरियर बॉर्डर्स ऑफ femoral condyles होती है palpated distal होती है and posterior to limb patella, and limb rotated superimposed them vertically. And central ray at right ankle to axis of tibia. जो सेंट्रल रे होगी उसमें राइट एंकल टू एक्सिस ऑफ टिबिया पे होगी. एंड दिस इज द नी लेटरल व्यू. एंड image criteria should include knee joint should be seen lateral position, and proximal and tibia should slightly superimpose the head of the fibula. This should be like this. This is how it look like knee lateral view. And patella, for the patella we do some basic views PA and lateral, and a special view known as skyline, and this is very important view. So For the patella, PA projection is obtained with the patient prone, while lateral view is obtained lateral view of the knee joint in lying position. So anatomic structures should include patella femoral space, and this is the knee a patella AP view, and this is the patella lateral view, and skyline view for the patella. This is special view for patella, and positioning place patient prone on table. Align long axis of affected knee to midline of cassette and gently assist with flexion of knee until patellar surface is perpendicular to the face of table as far as patient can tolerate, and central ray should be directed central ray to pass through femoropatellar space and inferior to superior. So this is how it look like patella skyline view, and these are the patella bones. Okay, and let's see next image criteria which should be included in the skyline view. So patella should be seen in tangent inferior superior projection, and femoropatellar space should be open with condyles well seen tangential projection, and shaft of femur has basically two views, AP and lateral. So anatomic structures in the view femur and hip joint and knee joint should be shown, and AP femur view. Positioning patient lies supine without any rotation of the pelvis, and the leg rotated 15 degrees internally, and central ray should be mid femur thigh perpendicular to the cassette, and this is the femur AP view shaft of femur, and image criteria should include the entire length of the femur should be visible including hip and the knee joint, and lateral view of the shaft of the femur, and patient lies supine, then turn to the side of the interest on the table with the hips, knees slightly flexed, and pelvis is rolled backward and separate the two thighs distally, and femoral condyles should be placed such as they are superimposed on each other, and central ray to the mid femur perpendicular to the cassette, and image criteria should include entire length of shaft which should be seen, and the patella in the profile, and view should include the upper end of the fibula, and the interior and posterior margins of the femoral condyles should be superimposed. So anterior और posterior margins होने चाहिए, and femoral condyles superimposed होने चाहिए, and hip joint. For the hip joint we used to do AP and lateral view. AP should both can be both AP or single hip AP, and anatomic structures include hip joint both or single, and hip AP view. Patient lies supine without any rotation of the pelvis, and leg rotated 15 degrees internally, and centering. So central ray to the midpoint between the pubic symphysis and anterior superior iliac spine. If single hip is to be taken, then in case of both of hips, centering is done at a point 1 inch above the pubic symphysis. If we are doing single hip, then centering will be midpoint between pubic symphysis and anterior superior iliac spine, and if we are doing both hip, then centering would be 1 inch above the pubic symphysis. So this is the pelvis AP view, and bilateral hip are included here. An image criteria should be included. Pelvis with both hip joints and upper third of femur should be included in the radiograph, and lateral view single hip joint And positioning should be: patient lies supine on the table with knee and hip flexed on the affected side, and the femur is abducted 45 degrees from vertical to place femoral neck parallel to the cassette, and centering should be central ray to the mid femoral neck. And this is the hip lateral view, how it looks like. And image criteria should include hip joint should be properly visualized in the radiograph, and pelvis AP view. So anatomic structures include pelvis, lumbosacral joint, and both hip joints, and anterior posterior view for the pelvis. And patient lies supine with the knees flexed, heels separated, and feet rotated internally by 5 to 10 degrees to the vertical, and central ray to the midline at the point midway between the level of anterior superior iliac spine and superior border of the pubic symphysis, perpendicular to the film. And this is the pelvis AP view. And image criteria: the pelvis should be visible without any rotation, judged by greater trochanters, with which should appear symmetrical in shape, जो कि symmetrical होना चाहिए shape में. And sacroiliac joints basic views which are done for SI joint are AP and posterior oblique view. And in AP we include both SI joints, and posterior oblique view includes single joint. And anatomic structures include both SI joints and sacrum. And AP view for the sacrum, SI joints. And patient lies supine without rotation of the pelvis. Both the anterior superior iliac spine should be equidistant from the tabletop, and knees flexed and legs are extended. And central ray to the midline at the point 5 cm below the level of anterior superior iliac spine, with a cranial angulation of 30 to 45 degrees. Cranial angulation should be there 30 to 45 degrees. And image criteria should include both SI joints, sacrum, and LS junction should be seen clearly. And this is the SI joint AP. And let's see posterior oblique view of the SI joint. And positioning should be: patient lies supine and is rotated 25 to 30 degrees onto the side opposite to the joints to be examined, and centering direct central ray perpendicular to the cassette 2.5 cm medial to the F side axial as size. and जो सेंट्रल रे है वो परपेंडिकुलर होनी चाहिए टू द कैसेट, एंड 2.5 सेंटीमीटर मीडियल होनी चाहिए टू द अप साइड ऑफ द SI joint. And image criteria should include SI joint and projected in the mid of the film. So this is the right SI joint posterior oblique view. And radiology of the chest now. So thorax is the part between the root of the neck and the diaphragms. It contains the right and left lung on the two sides, with the mediastinum in the center, and the mediastinum contains the trachea, main bronchi, esophagus, and the heart, and the vessels related to it, and the thoracic cavity. सो जो थोरैक्स है उसमें रूट ऑफ नेक होती है, डायफ्राम्स होते हैं, कंटेन करता है राइट लेफ्ट लंग्स ऑन द बोथ साइड विद द मीडियास्टिनम, एंड मीडियास्टिनम में ट्रैकिया होती है, मेन ब्रोंकाई, एसोफेगस, हार्ट एंड वेसल्स रिलेटेड होती हैं. थोरैसिक कैविटी is bounded by thoracic cage made of ribs and chest wall muscles and is lined by pleura internally. Pleura is the covering of lungs. For chest radiography, the patient is instructed to change into a cotton gown. पेशेंट को एक कॉटन गाउन दिया जाता है चेंज करने के लिए. एंड care should be taken that there is no radio opaque objects left on the under the gown, and long hairs must be pinned up so that they should not come in the way of lung field. And radiographs of chest which can be taken. Chest PA view is the most routinely done, and chest AP view in the trauma cases, and chest X-ray lateral also done, a picogram, lordotic view, lateral decubitus. These 6 views are the most common views for the chest. And chest PA view. So chest PA positioning, patient stands with his face towards the cassette with chin extended and resting on the middle of the top of the cassette without any rotation, and upper borders of the cassette should be placed 2 inches above the level of shoulder, so to ensure spices are included, and shoulders are rotated forward and pressed downward in contact with cassette, and this is accomplished by the placing dorsal aspects of hand over the iliac crest. So centering should be at the level of T5 vertebra and angled 50-degree caudally to bring central ray coincident with the middle of film. So here I think this should be 5-degree. This is not 50. And a long FFD should include 150 to 180 centimeter is used to minimize cardiac magnification. And image evaluation of the criteria, clavicles should be symmetrically placed and scapula rotated away from the lung field, and apices and bilateral costophrenic angles should be included in the film. And this is the chest PA view. And now chest AP view. So chest AP view, patient standing or lying down with back against the cassette, shoulders are brought downwards and forward with back of hands below hips and elbow well forward. It is preferable to have arms laterally rotated with palms facing forward, and centering should be at the first centered at external angle and angled until it coincident with the film. And projection is not used for measurement of the heart size as it leads to cardiac magnification. And this is the chest AP view and chest lateral view. For the radiography of the chest PA projection, patient is rotated to the 90-degree, bring underside of examination contact, and hands are folded above the head and median sagittal plane and of the body parallel to the cassette. Cassette is adjusted to include apices and lower border of the level of the L1 vertebra, and centering should be at angle of film in mid axillary line and at the T5 vertebra. And this is the chest lateral view and a picogram. So a picogram is a special view for demonstration of lung apices. It is achieved by modifying AP projection in following ways. Patient in AP position as for chest X-ray and projection of central ray 30-degree cranially centered at external angle. And this is the chest apicogram and lateral decubitus view. We will do this view in the next video. So let's complete it. Like, share and subscribe.